Our subject today is measles and rubella. Objectives: define measles, rubella, and MMR vaccine, which is measles, mumps, rubella vaccine. Explain the causative agent of measles and rubella diseases. Explain pathogenesis, diagnosis methods, control, and treatment for these viruses. Measles is a highly contagious infectious disease caused by measles virus, and it's considered as an airborne disease which spreads easily through cough and sneeze of infected person. It may be spread through direct contact with mouth or nasal secretion. Measles virus is a single-stranded, negative-sense, non-segmented enveloped virus, RNA virus, of the genus Morbillivirus within the family Paramyxoviridae. Measles is so contiguous that if one person infected, so 90% of the nearby non-immune persons also may infect it. Human is the only natural host of the virus, and there is no animal reservoirs known to exist. Now we will talk about entry of the virus. Entry of the virus. The measles virus has two envelope glycoproteins, the viral surface hemagglutinin H and the membrane fusion protein F. These proteins are responsible for host cell binding and invasion. 3 receptors for hemagglutinin protein have been identified. First of all, complement regulatory molecule CD46. Then we have signaling lymphocyte activation molecule, which is also called SLAM. Finally, we have cell adhesion molecule, which called Nectin-4. This figure demonstrates the measles virus structure, and we can demonstrate the hemagglutinin also fusion proteins. Genome replication and virus assembly. The negative sense strand of single-stranded is used to create a positive copy. Then this will be used to create a new negative one, and so on, to create many copies of the single-stranded RNA. The single-stranded RNA is then translated by host ribosomes, producing necessary viral proteins. The viruses are then assembled and the cell will lyse, leading to restarting the cycle in a new cell. Symptoms of this infection. Symptoms typically begin 2 weeks after exposure to the virus. The classic symptoms include fever, cough, carousel, conjunctivitis, also maculopapular rash. Fever is common and typically lasts for about 1 week, and this fever will be high and it can reach 40 degrees centigrade. The most diagnostic symptom is complex spot, as these spots can be seen in the mouth. These symptoms already temporary and therefore rarely seen. The characteristic measles rash is classically described as generalized red maculopapular rash that begins several days after the fever starts. It starts on the back of the ears and after a few hours spread to the head and neck before spreading to the other parts of the body. The rash is said to stain, changing color from red to dark brown before disappearing. Now we will talk about risk factors for measles virus infection. First of all, loss of passive antibodies before the age of 14 immunization. Also, travel to area where measles commonly occurs or contact with the travelers from such an area. Another risk factor using of corticosteroid therapy or immune suppression following recipient of an organ or a stem cell transplant. Finally, we have immune deficiency caused by HIV. Complications of measles are relatively common, ranging from mild ones such as diarrhea to serious ones such as pneumonia, laryngotracheal bronchitis, otitis media, acute brain inflammation, and coronal ulceration. In addition, measles can suppress the immune system for months, and this can contribute to bacterial superinfections such as bacterial pneumonia. Measles can cause serious illness requiring hospitalization. 1 out of every 1,000 measles cases progress to acute encephalitis, which often results in permanent brain damage. 1 to 3 out of every 1,000 children who become infected with measles will die from respiratory and neurological complications. Laboratory diagnosis. First, we have isolation and identification of the virus. Measles virus grows slowly, typically cytopathic effects. We can demonstrate the multinucleated giant cells containing both intranuclear and intracytoplasmic inclusion bodies. Diagnosis of measles can be done with confirmation of positive measles IgM antibodies or detection of measles virus RNA from throat, nasal, or urine specimen by using the Freeze transcription polymerase chain reaction assay. Immunity against this virus. Mothers who are immune to measles pass antibodies to their children. Such antibodies will usually give the newborn some immunity against measles, but these antibodies are gradually lost over the course of the first 9 months of life. So infants under 1 year of age whose maternal anti-measles antibodies have disappeared become susceptible to infection with the measles virus. Treatment. There is no specific antiviral treatment if measles develops. Instead, the medication are generally aimed at treating superinfection, maintaining good hydration with educated fluids and pain relief. Young children are also given vitamin A, which acts as an immunomodulator that boosts the immunity against this virus and decreases the risk of serious complications. Treatment is supportive with paracetamol to reduce fever and pain. Using of vitamin A treatment is recommended to decrease the risk of blindness. However, vitamin A does not prevent the disease. A systematic review of trials into the use of vitamin A found that it cannot reduce or decrease the mortality, but if they use or given 2 doses of 200,000 international units of vitamin A was shown to reduce mortality for measles in children younger than 2 years old. Now we will talk about the second virus in this lecture, which is rubella. Rubella, also known as German measles, is an infection caused by the rubella virus. is an acute febrile illness characterized by a rash and lymphadenopathy that affects children and young adults. However, infection during early pregnancy may result in serious abnormalities of the fetus, including congenital malformation and mental retardation. The consequences of rubella in utero are referred to congenital rubella syndrome. Classification of the virus. Rubella virus is a member of the Tocaviridae family, is the sole member of the genus Ribivirus. It is a single-stranded RNA positive sense. This virus already have envelope and consists of 3 or 4 major structural polypeptides. Structure of rubella virus. The spherical virus particles have a diameter of approximately 50 to 70 nanometer and are covered by a lipid membrane derived from the host cell membrane. There are prominent projections composed of viral envelope proteins E1 and E2 embedded in the membrane. The E1 glycoprotein is considered immunodominant in humoral response induced against the structural proteins and contain both neutralizing and hemagglutinating determinants. This figure shows to you the rubella virus, and we can demonstrate the glycoproteins of this virus, also the nucleocapsid. Replication of rubella virus. The virus attach to the cell surface via specific receptors and are taken up by an endosome. At the neutral pH outside of the cell, the E2 envelope protein covers the E1 proteins. When the pH is dropped inside the endosome, frees the outer domains of E1 and cause the fusion of viral envelope with the endosomal membrane. Thus, the capsid reach the cytosol, decays, and it will release the genome of the virus. The positive single-stranded at first only acts as a template for the translation of the non-structural proteins, which are synthesized as a large polyprotein and are then cut into single proteins. The sequences for the structural proteins are first replicated by the viral RNA polymerase via complementary negative single-stranded RNA as a template and translated as a separate short messenger RNA. This short subgenomic RNA is additionally packed in a virion. Translation of the structural proteins produce a large polypeptide. This is then cut into E1, E2, also the capsid protein. E1 and E2 are transported into the endoplasmic reticulum with the help of N-terminal signaler sequence. From the endoplasmic reticulum, the heterodimeric E1-E2 complex reaches the Golgi apparatus, where the budding of the new variants will occur. The virus is transmitted by the respiratory route and replicates in the nasopharynx and lymph nodes. The virus also can be found after 5 to 7 days of infection in the blood. Then it can spread throughout the body. This virus has the ability to cross the placenta and infect the fetus. During incubation period, the patient is contiguous, typically for about 1 week before rash appearing and about 1 week after the appearance of rash. Now we will talk about symptoms of rubella. The primary symptoms of rubella virus infection is the appearance of rash, on the face, which spread to the trunk and limbs. The facial rash usually clears as it spreads to other parts of the body. Other symptoms are low-grade fever, swallowing glands. The fever rarely reaches the 38 degrees centigrade. In older children and adults, additional symptoms may be present, such as swallowing glands, itching joints, especially in young women. Severe complications of rubella include brain inflammation, low platelet count, also ear infections. Rubella virus can cause congenital rubella syndrome. In the newborn, this syndrome follows intrauterine infection by the rubella virus and comprises cardiac, cerebral, ophthalmic, and auditory effects. It may also cause prematurity, low birth weight, and neonatal thrombocytopenia, anemia, and hepatitis. The risk of major defects of organogenesis is highest for infection in the first trimester. Many mothers who contract rubella within the first critical trimester either have a miscarriage or stillborn baby. If the fetus survives, he may be born with severe heart disease or disorders, blindness, and deafness. The skin manifestation due to this virus is called blueberry mewing lesion. For these reasons, rubella is included on TORCH complex of prenatal infections. Immunity against rubella virus. Rubella virus specific IgM antibodies are present in people recently infected by rubella virus, but these antibodies can persist for over a year, and a positive test result need to be interpreted with caution. The presence of these antibodies along with or short time after the characteristic rash confirm the diagnosis. Now we will talk about laboratory diagnosis of rubella virus. First, we will isolate the virus and identify it. An esophageal or throat swab can be taken 6 days before and after the onset of rash. Also, by reverse transcription PCR, we can detect the nucleic acid. Finally, we have serology to detect specific IgM, also for detection of IgG to evidence the immunity. Treatment. There is no specific treatment for rubella. However, management is a matter of responding to symptoms to diminish discomfort. Treatment of a newborn baby is focused on management of the complications. Congenital heart defects can be corrected by direct surgery. Management for ocular congenital rubella syndrome is similar to that for age-related macular degeneration, including counseling, regular monitoring, and the provision of low vision device. Finally, we will talk about the MMR vaccine, which is measles, mumps, rubella vaccine. This vaccine already taken or given by 2 doses. The first dose is generally given to children around 9 to 15 months of age. Second dose at the 15 months to 6 years, with at least 4 weeks between the 2 doses. This vaccine also recommended in those who do not have evidence of immunity, those with well-controlled HIV, and within 72 hours of exposure to measles among those who are incompletely immunized. the vaccine already given by injection. Thank you.